Bismillahirrahmanirrahim. Quote of the day is: when your good deed pleases you and your evil deed grieves you, you are a believer. This is the quote by Prophet Muhammad sallallahu alaihi wasallam. My name is Dr. Aamna Khalid. I'm PGR Community Medicine. Today I will present the topic of demographic transition cycle under the kind supervision of Professor Dr. Saira Afzal, who is Dean Institute of Public Health, Lahore. Learning objectives for today's presentation are: we will define the concept of the demographic cycle or the demographic transition model, describe the 5 stages of the demographic cycle and their key characteristics, explain the changes in birth rate, death rate, and population growth across different stages, analyze the relationship between demographic transition and epidemiological transition. We will discuss the public health implications, opportunities, and threats associated with each stage, and then the practice of MCQs. So a demographic cycle is a model describing how a country's population changes over time as it develops economically, socially, and technologically, tracking shifts in birth rates, death rates, and overall population growth. So the core variables included in the demographic cycle are birth rate, death rate, and population growth rate. The associated or linked factors are industrial development, socioeconomic progress, and health infrastructure. The policy applications we derive from this cycle are the health planning, economic policy, and population control. This is a diagrammatic presentation of the demographic transition. You can see that there are 5 stages shown here. Birth rate, death rate, and total population. These are the 3 curves shown in this picture. If we focus on stage 1 first, you can see that birth rate and death rate both are at the peak, and the total population is just below, or it's the lowest, and it's stable, and or you can say that there is a very slow increase. And the associated population pyramid, as we have discussed the population pyramid in the previous class. So you can see that because the birth rate and death rate are high, the population pyramid associated with this stage has a broad base and a very narrow peak because of the high death rate as well. If we move to the next stage, the second stage, birth rate is still high, which is a green curve, but death rate has markedly decreased, and the population has also markedly increased. And the associated population pyramid is triangular in shape, and you can see it. But because the death rate has decreased, now the top portion is not that narrow as compared to the previous pyramid. And then we come to the stage 3, and you can see that birth rate is decreasing, but very slowly. And now birth rate has decreased markedly. Population is increasing still, but slow as compared to the second stage. And again, you can see the population pyramid shown in this stage. In the fourth stage, you can see that birth rate is decreasing, but slow as compared to the stage 3. Death rate has now become stationary. It's low and stationary as well. It's not decreasing further. Population is somewhat stable, and you can say that it's increasing very slowly. If we move to the fifth stage, you can see that birth rate is now rising again. Death rate is still low and stable, and population growth is again stable, or you can see a very slow increase. And the population pyramid associated with this stage has a broad base, as narrow base, and a broad top portion, which shows that death rate has markedly decreased now. So here we compare all the stages in the tabulated form. The first stage, which is called high stationary stage, and if we divide them into the phases, then it is a pre-transitional phase where birth rate is very high, death rate is also very high, population growth is very slow. Economically, we classify it as the pre-industrial stage, and epidemiologically, we classify it as the phase of pestilence and famine. We will also discuss the detail in the next slides as well. The second stage is early expanding or the early transitional phase, where birth rate is high but the death rate is declining and the population growth is rapid. Economically, this is the early industrial phase, and epidemiologically, it is the receding pandemics phase. Third one is late expanding stage or the mid-transitional phase, where birth rate is declining but death rate is low. Growth rate is moderate, and economically, it is the mature industrial phase, or you can also say late industrial phase. And epidemiologically, this is the stage of degenerative diseases. Then comes fourth stage, which is the low stationary or the late transitional phase, where both the birth rate and death rate are low, population growth is stable. Economically, this is the post-industrial phase, and epidemiologically, this is the stage of delayed degeneration. A fifth stage is declining, where the phase we name it as post-transitional, where birth rate is very low, death rate is also low and maybe rising. Population growth is negative, means decreasing, means not increasing. And economically, we can define it as digital or the stage of automation. And epidemiologically, this is the stage of emerging diseases, emerging infections. This is again the um, diagrammatical picture of demographic transitions, where they have shown in the bars. Red bar shows the birth rate, and the blue bar shows the death rate, and you can see how both of them are decreasing. But in the second stage, the major shift was in the death rate, and then in the third stage, the birth rate was shifted, means it decreased grammatically. So now we come to the detail of stage one, which is the high stationary stage. And as we said, this is the stage of pestilence and famine epidemiologically, where birth rate and death rate are very high and population growth is very slow or stable. So what are the reasons for a high birth rate? Because there is lack of contraception, there are early marriages, children needed for farm labor, so they are produced more. There is high infant mortality, parents had more children. Cultural and religious factors were also associated, and low female education. And the reasons for high death rate are the poor sanitation, no healthcare or hospitals, frequent epidemics like plague, cholera, smallpox, malnutrition, wars, and famines. The opportunities associated with this stage are that there is a large potential for the labor force for agriculture and manual work, strong extended family support systems for children and elderly, low pressure on the urban infrastructure because most people are living in the rural areas, natural population balance maintained by the high death rate. Threats associated with this stage are that there are frequent epidemics, as we discussed, like cholera, plague, and smallpox. They spread easily. There is high infant and maternal mortality due to the lack of healthcare facilities, food shortages and famine from low agricultural productivity, low life expectancy, often below 40 years, economic stagnation with limited technological advancements. There are poor living conditions, even the basic facilities like lack of the clean water and sanitation. So the public health implications associated with the stage one are that there is extremely poor health infrastructure and high prevalence of infectious diseases, high infant and maternal mortality, malnutrition and famine is common. There is lack of safe drinking water and sanitation, and very low life expectancy. So our focus should be on providing the basic sanitation, the provision of clean water supply, food security, control of epidemics, and primary healthcare establishment. So now we come to the stage two, which is early expanding stage, and epidemiologically we define it as the age of receding pandemics, means pandemics are now reducing, where birth rate is still high, but death rate has decreased rapidly. Population growth is also very rapid. Reasons for declining death rate now is the improved sanitation and clean water, better food supply and agriculture, introduction of vaccines, basic medical care has now expanded, reduction in major epidemics. Why birth rate remains still high? Because cultural preferences are there for large families, low female education, limited contraception access, and children still seen as economic assets. The opportunities associated with stage 2 are rapid growth of labor force as death rate declines, economic expansion, industrialization creates new jobs, urban development means growth of cities and infrastructure, improved public health like vaccines and sanitation, they reduce mortality, agricultural improvement boosts the food production, but there are some threats also attached with this stage, like the population explosion. High birth rate plus falling death rate will cause a rapid population explosion. Pressure on the resources like food, housing, education, and healthcare. Urban overcrowding, migration to cities creates slums. Environmental degradation from rapid industrialization. Unemployment, jobs can't keep pace with the population growth. Burden on healthcare system from rapidly growing population. So the public health implications in stage 2 are there is rapid population growth, which increases the health services demand as well. Infectious diseases still are the major cause of mortality. Improving sanitation and vaccine programs, maternal and child health services become essential. Urbanization leads to slums and environmental health issues. So our focus at this stage should be the immunization programs, nutrition programs, maternal and healthcare facilities. These should be strengthened. Primary healthcare should be expanded, and communicable disease control should also be focused. Now we come to the stage 3, which is late expanding stage, and epidemiologically we call it the age of degenerative and man-made diseases, where birth rate is declining and death rate is low. Population growth is moderate. Reasons for declining birth rate is now the greater female education and employment, urbanization changes the lifestyle, family planning programs, higher cost of raising children, cultural shift towards smaller families. Health conditions now are better healthcare systems, low infant for mortality, longer life expectancy, non-communicable diseases now emerge like heart disease, cancer, and diabetes. So the opportunities associated with stage 3 are the demographic dividend, means we have the large working age population which boosts the productivity, economic development, expansion of the manufacturing and services, improved education, especially access for women, better healthcare means the hospitals, advanced treatments, and preventive care have improved. There is improved quality of life, higher incomes, and living standards. Um, I should also mention here that while studying about the stage 3, we should keep it in mind that Pakistan is going through the stage 3 of demographic transition. I will also tell it in the next slide as well. The threats associated with stage 3 are the lifestyle diseases, heart disease, diabetes, and obesity. They all rise. Urbanization challenges like traffic, pollution, and stress, social inequality, economic growth benefits not evenly distributed, environmental pollution from industrial expansion, changing family structures like decline of the extended families. And one major threat associated with this stage is that if we do not utilize our demographic dividend, which is our youth, then there will be a catastrophe. The youth will not be able to find the job opportunities. They will have lack of interest in their education, and they will be more indulged in the crimes and such wrong activities. Uh, the public health implications associated with stage 3 are there is decline in the communicable diseases, but there is rise in the non-communicable diseases like cardiovascular diseases, diabetes, and cancer. Lifestyle-related health problems are now increased, improved healthcare, and longer life expectancy. So our focus here should be on the health education, NCD, that is non-communicable disease prevention programs, screening and early diagnosis, environmental health protection. Now we come to the stage 4, which is the low stationary stage, and epidemiologically we call it the age of delayed degenerative diseases. Um, in this stage, birth rate is low and death rate is also low. Population growth is stable or near zero. Reasons for maintained low birth rate is the family planning and contraception widespread use, career priority over early parenthood, delayed marriages, urban lifestyle preferences, and a high economic cost of children. Conditions in this stage are that there are excellent healthcare systems, high life expectancy, maybe 75 years or more, low infant mortality, chronic diseases, and mental health concerns are dominant in this stage. So the opportunities in this stage are the stable population supports the long-term sustainable development, high economic productivity, means the skilled workforce and advanced industries, technological advancement in the science and healthcare, strong preventive and curative health services, higher quality of life, better education, housing, and living standards. The threats associated with this stage are that there is aging population, which is growing proportion of the elderly people, rising healthcare costs, including diseases need long-term treatment, pension and social security burden on the governments, and labor shortages because fewer young people are entering the workforce. Mental health challenges include stress, depression, and social isolation. So the low stationary stage, which is the stage 4, has some public health implications like health. There is high life expectancy, advanced healthcare, chronic diseases dominate the health burden, increasing mental health issues, growing aging population, high demand for preventive healthcare services. So our focus should be now on the chronic disease management, health promotion, mental health services, and elderly healthcare programs. Now we come to the last stage, which is the declining stage, or epidemiologically we call it the age of emerging or re-emerging diseases, where the birth rate is very low, death rate is also low, but it may rise, and population growth is negative. Reasons for very low birth rate is again the delayed or no marriage trend, career priorities dominate, very high living cost, preference for child-free lifestyle, advanced contraception. Health conditions are highly advanced healthcare, very high life expectancy, 80 years or more, aging population where people have dementia, Alzheimer's, and cardiovascular diseases, emerging infectious diseases and antibiotic resistance. This is a major problem associated with the stage 4. Emerging infections, I should briefly tell here that emerging infections or the re-emerging infections are the ones which change their epidemiology and they were not a public health threat or problem or issue, but now due to many environmental conditions and the many living conditions and the growth population growth changes, now they entered the cycle of transmission, and now they are causing the infections in human beings. And as the infections emerge and the antibiotic resistance also develops against them. So these are some major problems associated with this stage. But there are some opportunities as well, like the technological innovation, AI, artificial intelligence, and automation compensate for the labor gaps. The high living standards with strong healthcare systems focus on quality of life, like health, wellness, and elderly care. Immigration opportunities attract skilled workers to sustain the economy. Threats of this stage are that the population decline, there is very low birth rate, which shrink the population, severe aging, high dependency ratio, where we have very few workers and there are many elderly. Economic slowdown, there is reduced workforce, which decreases the productivity. High burden of chronic diseases like dementia, cardiovascular diseases. Social support challenges like growing demand for the elderly care. Workforce shortages across many industries. So the public health implications are the very large elderly population, high prevalence of the age-related diseases, and increasing healthcare expenditure, greater need for long-term and geriatric care. So our focus in this stage should be on the geriatric healthcare, long-term healthcare services, palliative care, and the social support for elderly populations. So this is the examples of different countries that in stage one there is no country actually which is still in the stage one. This is a historical pre-industrial societies. Stage two is the stage where there is rapid population growth and declining death rate. Afghanistan, Sudan, Niger, these are the countries who are in the stage two. Stage three has the maximum opportunities, which is majorly the demographic dividend, that we have large working age populations. Now it's up to us, our policies, that how we utilize them. And Pakistan, India, Brazil, and Mexico, they are in the stage three. Stage four is the stage where populations are stable and aging workforce are emerging now. Like USA, UK, France, and Australia, they are going through stage four. Stage five is the stage where populations are shrinking and they have the severe aging challenges. Japan, Germany, Italy, and South Korea, they are going through the stage five. Uh, this is the graph showing that how population size has changed since 1800, and although the data is taken till 2024, but the dotted lines show the projected population, which is predicted till 2001, means 2100. And although Pakistan is not shown in this picture, but you can see that as India is also in the same stage. So you can see, as we talked yesterday about the population momentum, that although we are in the stage three, and you can see if we see the neighboring country India, that the population how after 1950 has dramatically increased, and it's still increasing even after 2024, 25, and then after 2050 it will start decreasing. And almost same graph or line will also be followed by Pakistan as well, because they both are in the same stage. So how demographic transition shapes the health systems and health policies? There is the shifting disease burden. As populations transition through stages, health systems must pivot from infectious disease control to the managing of chronic, non-communicable, and age-related conditions. Evolving health priorities, policy priorities evolve from basic sanitation and immunization to health promotion, non-communicable disease prevention, mental health services, and geriatric long-term care. The system and a policy transformation, the demographic transition demands continuous health system reforms, the infrastructure investment, workforce retraining, and policy frameworks aligned with the population age structure. So the conclusion or some takeaways, key takeaways from the demographic cycle are that the countries move from high mortality and fertility to low mortality and fertility as they develop. The transition is driven by the health advances, education, industrialization, and economic growth. Each state presents with their unique opportunities and threats, and understanding this cycle enables the effective health planning, economic policy, and population management. So this was all about the demographic cycle. Now we come to the practice of MCQs. Question number one is a country has very high a country has very high birth and death rates. Infectious diseases and famine are common. The life expectancy is around 35 years. The population size remains relatively stable. Which stage of the demographic cycle does this scenario represent? Option A, early expanding stage; B, late expanding stage; C, high stationary stage; D, low stationary stage; and E, declining stage.
C.
Yes, C is the right answer. Question number two. Our country shows declining birth rates due to female education, family planning, and urbanization. Death rates remain low and population growth is slowing. Which stage of demographic transition does this describe? Option A, high stationary; B, early expanding; C, late expanding; D, low stationary; and E, declining. No, this is option C,
D.
late expanding. This is the late expanding phase where death rate is low and population, they say population growth is slowing. It is not a stable or stationary. Um, it is still increasing, but at a slow rate. Question number three is a rapidly developing country has declining death rates due to improved sanitation and vaccination, but birth rates remain high. The population is increasing quickly, putting pressure on housing and food supply. Which major demographic problem is most likely to occur? Option A, population aging; B, population explosion; C, negative population growth; D, workforce shortage; and E, high elderly dependency.
B.
Yes, B is the right answer. Question number four. Public health authorities in a country prioritize vaccination programs, improve sanitation and maternal care to reduce infectious disease mortality. Which epidemiological phase is most consistent with this situation? Option A, age of pestilence and famine; B, age of receding pandemics; C, age of degenerative diseases; D, age of delayed degenerative diseases; and E is the age of emerging diseases.
B.
B is the right answer. Question number five. A country with a large working age population has the potential for rapid economic growth if adequate employment and education opportunities are provided. What demographic advantage does this represent? Option A, population explosion; B, demographic stagnation; C, population aging; D, demographic dividend; and option E, population decline.
D.
D is the delta is the right answer, demographic dividend, because we have a large working age population. Question number six is in a certain country, a majority of deaths occur due to cardiovascular diseases like cancers and stroke rather than infectious diseases. This pattern indicates which epidemiological transition phase. Option E, age of pestilence and famine; B, age of receding pandemics; C, age of degenerative diseases; D, age of nutritional deficiency diseases; E, age of infectious disease resurgence.
C.
Yes, C is the right answer. Question number seven, government is implementing policies encouraging couples to have more children because the country's birth rate has become extremely low. Which demographic problem is the government trying to address? Option A, population explosion; B, youth bulge; C, population decline; D, child mortality; E, overcrowding.
C.
Yes, C is the right answer. Question number eight is a developed country encourages immigration policies to maintain its workforce and support economic growth. Which demographic challenge is the country trying to solve? Option A, population explosion; B, high infant mortality; C, urban overcrowding; D, high fertility rates; and E, labor shortage due to aging population. E is the right
C.
answer. E is the right answer because they have labor shortage. That's why they have encouraged the immigration to maintain their workforce. Question number nine is a country's healthcare system is focusing on the long-term care facilities, rehabilitation centers, and dementia management. Which population trend is driving this policy? Option A, high fertility. B, population aging. C, high infant mortality. D, rapid urbanization. And E, population explosion.
B.
Yes, B is the right answer. Question number 10. A developing country has a high child dependency ratio due to a large proportion of children under 15 years of age. What is the main implication of this demographic structure? Option A, increased healthcare demand for elderly. B, high demand for education and pediatric services. C, decreasing fertility rates. D, reduced need for schools. And E, increased workforce participation.
B.
Yes, B is the right answer. This is the answer key to all of the questions. This is the YouTube channel of Institute of Public Health Lahore, where this presentation will be uploaded later on. Thank you so much.
Thank you so much, Dr. Amna. It was a very good presentation.
Thank you so much.